too hot outside, 40-42 degrees centigrade, and we are getting exhausted, tired, sitting inside at home only. Okay, but think about the diabetes. For them, the situation is much worse. During the high temperature, our body's metabolism changes, our glucose level goes ups and downs, chances of infection rates increases, and we get much more dehydrated. Our appetite comes down. Sometimes we have a lot of cravings, sometimes we eat very low. So let's talk about it, the diet and hydration, everything, part to part, one by one, how should be for a diabetes in summer. I am Dr. Moumita, general physician from Unihealth clinic. So for diabetes, hydration very much more important, not only for diabetes, for everyone. But why for diabetes? Because the chances of dehydration will be much more high. They will be more prone for ketosis. So they have to hydrate themselves very well. And what kind of water? Whenever we get much more dehydrated, we open the fridge, grab onto some kind of cold like some coconut water, some kind of juices, some kind of carbonated drinks, which is not good for a diabetes, which is not good for overall health, but especially not for diabetes. So go for water, obviously. And is that water is only solution? No, water with electrolytes. So water with a pinch of salt, okay, very low salt, along with lime should be fine. You can go for coconut water if you are very much dehydrated, or if you are doing exercise, you can go ahead for that. You can go for detox water, herbal teas, or another things that you can go like swamp water, zira water, that can also be taken as a beverages for them. Now, some tips like elderly people who are diabetic, for them they will have a more problem with constipation, especially in summer. So add some fiber into the water. So you can add some basil seed, that means sabza seed, you can add some chia seed, you can put some cucumber, and you can put some ginger to reduce the acidity of the body. So this kind of things you can do. Second thing, many of us go for juices. Avoid juices. Even if it is a low sugar juices also, avoid juices because it will stop the fiber. We are not getting the fiber. We need fiber for our better digestion, especially in summer. So have a whole fruit in place of just small juices. Third thing, so this is about the hydration part. When you come for foods, go for something which is having a more water content vegetables like cucumber, bottle gourd, ridge gourd, those kind of things, ash gourd. So we have to take more and more of vegetables and leafy vegetables, greens, palak, spinach, all these things. So along with the vegetables, you have to go for which is having a more water content of vegetables. Third things, along with this, we have to go for a low glycemic index carbohydrate. So what are the carbohydrate like rice, chapati? So in place of rice, white rice, we can go for unpolished rice like brown rice, like we can go ahead with the millets, you can go for red rice, you can go for oats. Again, oats also, there are multiple type of oats, but better to choose with rolled oats or steel cut oats. So which will have a more fiber, and these are all soluble fiber. So it will be very easy to digest. It will work as a prebiotic. At the same time, it will improve the gut health. It will reduce the constipation, and obviously it will also improve the satiety, and the glycemic index is also low. So this is about the food content. Timing is very much more important. It's not about only what you're eating, when you're eating. So try to take early dinner. Many of the time in the summer we feel bloating sensation, indigestion, sleep disturbances. That usually happens because we are taking late dinner. Maybe you are taking dinner at around 10 o'clock with a very spicy food. Obviously your sleep will be hampered. So try 3 hours before bed. So 6 to 7 p.m. will be the good time for a dinner. Breakfast, whenever you are having a breakfast, try to break your fast with the protein content. It could be something like egg white if you are a vegetarian. It could be something like sprouts, or it could be something like nuts. So some kind of protein content you start with your day. Now, so food, how much food is important, how much water or hydration is important. More than that, for a diabetic important is medicine, not doses, how you are keeping the medicine. So people who are depending on insulin, if you are keeping the insulin outside, it will not work. The insulin spoil with the high temperature. So better to keep it in the refrigerator, not in the freezer part, in the refrigerated part. And if you see that it is cloudy or the color change or clumping, discard it. It is not going to work. We heard many of the time that I am taking 30 units of insulin but it is not working. That is because the insulin is not effective anymore. So that is also an important point. One more point, people who are diabetes and who have heart problem or kidney problem, sometimes we put them on some medicine which causes more urine. We call them diabetics or water pills. If you are on water pills, or there are some diabetic medicine which increases more urine, if you are on those kind of pills, the chances that you get dehydrated more in summer. There are some tablets which cause low sodium. So when you are sweating a lot, so there are chances that you get low sodium, especially in elderly after 60-65. So meet with your doctor when the summer comes, and if you are feeling unusually very thirsty, unusually you are feeling exhausted. Summer is again a very much more time for infection, especially urine infection, kidney stone formation, especially with the diabetes, long diabetes more than 10 or 15 years with a kidney problem. For them, it is very easy to get urine infection or kidney stone formation. So drink water, but be careful. If you are some person who is having chronic kidney disease, or your creatinine is high, or if you have a liver problem, heart problem, you should take any doctor opinion before you have started any kind of more hydration or more water. Now, any diabetics or any metabolic disorder doesn't finish with exercise. So when you are doing exercise, you will definitely feel a lot of exhaustion, muscle cramp because of dyselectrolytemia in summer, because of excessive sweating. So in that moment, hydrate yourself before starting the exercise, hydrate yourself post workout, and whenever you are taking protein, be careful because it can cause much more nauseous or gut irritability. So need to be careful regarding that, and try to do exercise before the sun rises or after the sunset off, so the temperature will be favorable for us. Okay, without saying diabetes is not a disease, it's just a metabolic syndrome, and we can live our life happily with any other person, especially in summer, but be protected. Thank you.